All right, so let's take an opportunity to introduce the new Kinetic Control online course for the low back and hip. And this is one of the muscle synergy courses that's now joining the KCMT route. So previously, you've had the ability to access the foundation course, then progress through a number of different modules before applying for that KCMT accreditation. And we're just introducing the new course for low back, hip for muscle synergies. And it's great. We're having a chance to talk to the course deliverer, the course designer, Mark Comerford here. So hi, Mark.
Hi, Lincoln. Good to catch up again.
Yeah. So I think a really nice place to get the conversation going really is the KCMT routes. So I think somebody sort of first been exposed to Kinetic Control and then where they end up by the end of this process, and then we can sort of dive into a little bit more specifics of the muscle synergies course. So so the KCMT routes, I mean, for somebody who's a clinician coming into this, what do you feel are the main things they get from this process?
Well, starting with the foundation module, it's the theoretical framework behind it to a large extent. And it covers the entire spectrum of what we do in terms of movement evaluation, movement control training, and then looking at sort of the intricacies of looking at sort of the muscles, all the synergies that produce movements for us as well. And then from that, the basic components of that, there's components of that require that are the building blocks for the coordination efficiency component. So where we go in looking for trying to make a movement control diagnosis to some extent, where we look for the lost movement choices associated with pain and also movement control risk and performance risk for the future, and even some recurrence management. So looking at the site and direction component, looking at the ability to train, assess and retrain, how we control movement. So for example, lumbar flexion or cervical, low cervical side bending, whatever component we want, or shoulder forward tilt. So the coordination efficiency training is one we've already put them in place, and then going down into the synergy. So for every particular functional movement we do, we've got 3 different muscle roles that produce the synergies of movement. So we've got the muscles that have a local stabilizer role, the global stabilizer role, and the global mobilizer role, which we cover all the background of how they're developed and how they're defined in the foundation modules. But then the synergy courses really start to bring in sort of the fine tuning. So one of the ways that I think I'd like to present it to keep it in a simplified sort of way is, the sight and direction movement control tests, the cognitive movement control tests that identify sight and direction problems of coordination and efficiency. They're the ones that give us a diagnosis of the movement control impairments, but they relate directly to the movements or the pain provocative strategy activities we do. And so that's a good starting place to deal with the symptomology behind it. And even if we don't have symptoms, it gives us risk factors for future for performance and also for future symptoms. But then the synergies take us the next step. The synergies take us into sort of looking at, they're all the building blocks of movement, and then we want to evaluate them in terms of the global stabilizer efficiency, and then the mobilizers that work with them. So we look at the patterns and try to assess, are the stabilizers efficient, and if they're not, how to retrain that. And if the mobilizers are overactive as a response to pain or as a response to overtraining, then we can look at sort of how we might address that and improve the flexibility and stop the substitution. And then the final one, which we haven't got in the system here yet, are the local stabilizers that control intersegmental displacement and translation. So they're all the pieces of the puzzle, and we're now just putting online the low back and hip synergies.
Excellent. So we've got that synergies. Yes, we've got that theoretical basis. We kick it off with that. Then we move into specific testing and different ways of testing for specific regions, and that coming in 2 real formats: the coordination approach, and also then looking at the recruitment efficiency approach as well. And also within that, there's some different models to look at, the global compared to the sort of local translation management approach. Excellent. And then just a little bit on the master classes, because I guess the final part of this is the completion of a master class. We've got the managing restrictions up online now, and that's an extensive exploration of different ways to manage extensibility. So excellent piece of education, but also some things that we've been delivering still face-to-face, which is great as well. So anything in that sort of that nice list of master classes there, Mark, you want to highlight?
Well, the restrictions one is again something that, you know, from a manual therapy background, everyone starts with sort of, you know, and going right back to the ender approach to look at restrictions that cause compensations, and then how we can manage these restrictions to make movement more efficient. Within the restrictions one, we're looking at any particular myofascial restriction that might be there. So we can look at strategies to identify connective tissue and fascial restrictions and options for do that, like limb load, body load and gravity, extensibility work. We can also look at myofascial trigger points as a way to change sort of the overactivity and the range of motion that muscles can limit. We also then go down a couple of strategies for looking at the neurophysiology of how the central nervous system makes muscles overactive or short or increases tension in them. So looking at using muscle reflexes, or looking at autogenic and recurrent inhibition, like a contract relax technique that a lot of people are familiar with. And those strategies are particularly good for overactive short they're particularly good for atrophied short muscles. So muscles associated that have lost extensibility due to immobilization or disuse. But when muscles are overactive and short, yeah, looking at the neurophysiology behind how we can change that using reciprocal inhibition and using it, and every two joint muscle's got two options, proximal muscles and distal muscles, to provide that reciprocal inhibition. So we've got like 5 different key strategies to deal with any myofascial restriction, and how to analyze, you know, is it a connective tissue component? Is it a contractile component? Can we do active things about it? And if we can't do active things about it, we can do passive things like body load and gravity stretches for the fascias, or even trigger point, myofascial trigger point stimulation to change muscle flexibility, extensibility, and recruitment.
So one of the things I think within the whole KC framework is everything's for a reason, and a real fine resolution of why things are in there. And even within that one course of extensibility, the managing restrictions, you've given then some different routes to manage any given restriction based on its likely causes. So again, everything for a reason within the KC framework. So excellent stuff.